Hi and welcome to another video from the CTAD Clinic. My name is Dr. Mike Lloyd and I'm the Clinic Director. In the video today I'm going to be looking at two reasons why so many people with OSDD or partial DID or DID, these are the most complex and severe of the dissociative conditions, nearly always have child parts. Fundamentally, we know that the origin of such conditions such as OSDD and DID are within childhood. So it would make sense that there are going to be sort of like child elements to the presentation of these conditions. Now, firstly, OSDD and DID are really understood to be fully enmeshed with the sense of having different parts of identity. So we know that there are going to be lots of different manifestations of parts or alters or others, whatever they might be called, within those kind of conditions. And there's nearly always child parts. And actually the reason why I think are realistically down to sort of two main reasons. Now, this isn't going to be an exhaustive list. There's loads of reasons why any person or individual or system will have their own child parts and their own versions and the layout and the needs and the sort of the orientation of those child parts. But fundamentally, it comes down to two reasons. So this video is really just going to be looking at those two reasons and then a bit more of an understanding about what all of those mean. The first reason why child parts are nearly always present is the most obvious one. They are there to hold the trauma at the time. So because these are developmental conditions, neurologically speaking, they occur within the developing brain in childhood. It makes sense then that the difficulties, the traumas that are being experienced, the horrible stuff that's going on for a person is rooted in childhood. So the brain starts compartmentalizing and it compartmentalizes into what it knows. What it knows is childhood because the body is a child at the time, most commonly. So therefore the parts are likely to then be compartmentalized into childlike forms. So they're almost like a living record or a live event memory compartmentalized into a child identity. So that's why we would nearly always see child parts occurring in conditions like OSDD and DID that have their origins in traumatic childhood. The way that they present themselves is obviously not all that cognitive. It's going to be very, very emotional, often lots of distress, often lots of fear, often lots of reassurance seeking. They can be quite difficult to be able to sort of manage because they're almost like unconstructed kind of like elemental fear and process. It's very raw and it's very powerful, and they can really be very disruptive to any sort of systems or sort of like everyday ordinary adult functioning in the real world. And it's often the child parts that cause such disruption with the trauma that they hold that actually brings people into contact with services. The second reason is almost kind of like an equal and opposite thing, is that, and this could be completely separate child parts or the same child part might hold both of these. So the second reason is to hold on to the childhood that was never given or was never experienced. So we know that while the traumatic childhood means a lot of bad things are happening, it also means there's an absence of good things happening. So these child parts hold on to all the good stuff that they want, that they never got given, in the hope that one day they will have those things. And this can be really problematic because sometimes it could be the love of the parents or the love of the people who were causing all the problems in the first place. But a lot of times it manifests in kind of safer, more ordinary childhood things like the need for games or toys or sweets or, you know, the trappings of childhood. It's like they often want to sort of reboot and have another go at childhood. Now, this can make them quite needy or quite demanding in some respects. They can be very distractible by sort of like things, the trappings of childhood in the everyday world. So things like going shopping or trying to do ordinary things, and they might suddenly see something being triggered into their sort of their driven need, their action system for a childhood. They can take over the body and they can sort of run off, dash away and try and do all the things that they want to do, which sort of makes them feel like they are being like everyday ordinary children. Ultimately, it's about giving lots of reassurance and lots of time because all they're trying to do is recalibrate a lost childhood. Sometimes there can be a lot of grief and sadness packed into that, but the manifestation in through OSDD and DID is to try and sort of like have that childhood back, give it another go. So those are the two main most common features that I see within the clinical room working with people with OSDD and DID that have child parts. Is they're either kind of like just balls of distress and fear and trauma, or they're sort of like wanting to play and do games and do all these kind of different things, and or have sweets and toys and stuff like that. So again, the same child part might manifest in both directions, but it's often that you've got one set of child parts that contains all the first stuff and another child part that contains all the second stuff. And trying to organize life through those things can be very, very difficult indeed. So I'm going to look at, in future videos, a little bit more about this, about why certain parts kind of manifest and why they're most commonly done. Thought I'd start with child parts, because that's the most obvious stuff that's nearly always present for everybody with those two conditions, nearly always. Okay, so thanks very much for watching. Please leave any comments in the section below. Do all the usual stuff with not liking, subscribing and clicking the notifications button. Keep an eye on the community page for the webinars and training we've got coming up. And as always, between now and the next video, please do take great care.